Well, thank you very much for the invitation to participate in this interesting workshop. This is joint work with Yen Bai and Gabriel Mihalache. And let me just confirm that to say my disclaimer here that the views are ours and not those of the Federal Reserve Bank of Minneapolis or the Federal Reserve System. So, we're here. Motivation, as Paco said, sort of the motivation for this particular paper is the COVID-19 experience in Latin America, where it's been the region with maybe the largest human cost. As of December, it was about half a million people official have died from this epidemic, and not only a large human cost, but also there's been a sort of very depressed economic activity, massive declines in industrial production especially earlier in the year in 2020, but large output cost. And for Latin America and many emerging countries, this epidemic brings sort of additional problems relative to the problems that developed countries have faced, which is that governments have limited fiscal space to support their citizens. We see that many countries in Latin America have defaulted under government debt, and sort of sovereign spreads on this government debt spiked earlier and went down, but are still elevated relative to pre-pandemic times. In this context, we've seen many financial organizations, the IMF, the World Bank, the IDB, have developed, sort of deployed multiple debt relief programs to support these countries. So this is sort of the motivation, and what we're going to do in this paper is, just in this paper, the experience in Latin America has this triple crisis combined: health, economic, and debt. So what we're going to do in this paper is we're going to develop a framework that thinks about integrating these ideas. It's going to have an epidemiological module where an epidemic is going to create a health crisis in the tradition of the standard SIR models that maybe many of us have seen already and are familiar with. And this epidemiological model is going to generate sort of paths for infections and fatalities.
Sure.
Then there's going to be an economic module where the economy is going to decide on social distance measures to basically tame the epidemic and save lives. But of course, those social distance measures and lockdowns are going to be costly in terms of output. The economy is also going to borrow internationally, and that's going to be useful to support consumption. And it's also going to can also default on the debt. And this default risk is going to limit the fiscal capacity for this economy to both support consumption, but also support these investment in lives through social distance measures. So in this framework, there's going to be this two-way feedback loop where an epidemic is going to generate a debt crisis, because when the epidemic arises, there's going to be these social distance measures that depress output, combined with limits in fiscal capacity because of future default risk, is going to lead to defaults and sort of higher future defaults. That's one side, but the other side is that the fact that there's limits in fiscal capacity because of default risk, that is going to make lockdowns more costly, and that is going to put pressures into having smaller lockdowns, which will induce more fatalities. So in this framework, that creates this two-way feedback loop is going to produce this combination of a health, economic, and debt crisis. We're going to use the framework, and we're going to show you some quantitative stuff calibrated to Latin America, and we can use it as a laboratory to analyze different debt relief policies. And we find that these policies are going to be super useful because it's just going to allow this economy to support consumption as is standard, but also sort of being able to handle better the epidemic. In terms of our findings, so this is actually related to this theme that the last two papers have discussed. So an epidemic is going to generate a persistent, a longer debt crisis. So that is going to, with elevated spreads in their calibration for about 4 years. The lockdowns are going to be sort of happening for 1 year, and that they're going to be effective relative to in reducing fatalities relative to the case of laissez-faire, no lockdowns. But these sort of shorter-lived lockdowns, through the accumulation of sovereign debt, is going to induce these persistent effects from this epidemic. The epidemic is going to be very costly. The welfare cost is about 0.6% in consumption equivalence terms. So that's going to be our headline of findings. Then we're going to do some counterfactuals and some exploration. So one is sort of thinking about, how would this epidemic look with different financial markets? And we show that in an experiment, if financial markets would be perfect, then the outcomes are going to be much better in terms of consumption and in terms of course, avoiding a debt crisis, but also is going to allow better mitigation for this epidemic. In terms of the social, the debt relief policies, we're going to consider two types. So our first one is we're going to show you that in the calibrated model, voluntary restructurings between private lenders and the country are going to be possible, and sort of by reducing the debt and restructuring the debt, that is going to basically improve the welfare of the two parties. The second type of policy we analyze is a default-free loan. So the type of loans, say, that the IMF is giving to this country, and we find that those can be also very useful. And I'll go through the details as we move on. So the literature, so we're in the literature that is building up macro models that combined epidemiological models within the macroeconomy. But our focus here is on sovereign debt and on the application of Latin American emerging markets. Okay, so let me move to the model. So the model is going to be a small open economy model with preferences over two goods, consumption and life. There is going to be an unexpected shock, that is this COVID-19 epidemic. And the dynamics of the different populations, the infected, susceptible, and diseased population, are going to follow a standard susceptible, infected, recovered model, SIR model. The government here, we're going to consider a centralized planner that is going to borrow internationally, can default on the debt, and is also going to decide on the social distance measures that we're going to label them as lockdowns. And both default and lockdowns are going to be endogenous of intensity and endogenous duration. So just some details on the model. So this is these are the preferences. There's preferences over sort of a consumption good here, and there's going to be this utility from dying. So these phi t parameter are going to be the fatalities, and the parameter chi is going to be the parameter that controls the value of life. Output is going to depend the aggregate output is going to depend on productivity, and it's also going to depend on population, and it's going to be depressed with lockdown. So a lockdown of size L is going to depress output by 1 minus L times population. The epidemic, so this population N is going to enter into this epidemic after the epidemic hits. And the population is going to start all the population from being susceptible, susceptible to the disease, and then they're going to transit to infections, and then they're going to transit to either recovered or dying. As we've learned in the past year, it's sort of a key building block in this model is how new infections occur. And this is our notation here. These mu-x are how new infections, so the probability of being infected from the disease, if you are susceptible, are going to depend on the fraction of people that are already infected in the population, and also on this reproduction number are not. But these new infections are going to be, there's going to be a possibility of modulating those infections by choosing a lockdown policy else. So lockdown policy else are going to basically reduce the fraction of people that are engaging in a contagion and are going to reduce new contagions. The fatalities for this population are going to depend on the amount of on the fraction of people that are infected. So the more people are infected in a certain period, the more fatalities there are. So this is a very sort of builds on this work by Alvarez and Gentilippi, and basically what I want you to get out of this slide here is that these lockdown policies are going to basically have a trade-off. On the one hand, they're going to reduce infections, so that is going to improve the epidemic outcomes, but they could be costly because they're going to reduce output. Then we have the government debt part of the model. So the government is going to use these international debt operations to support consumption. And so you see that aggregate consumption, this is the the resource constraint of this economy. Aggregate consumption is going to be equal to output, but the government is going to be able to borrow, new borrowing, to support consumption if output is low, for example, through some lockdowns. The government can also owes some debt every period B, and it can choose to default on the debt if it wants to, and it's going to be a very varying duration. The price of new debt Q is going to encode future default risk and is going to compensate, as I show you over here, is going to compensate sort of risk neutral lenders from any possibilities of future default. We're going to have sort of a twist on a standard sort of default type model, which is that when the government defaults on a particular amount of debt, that debt actually accumulates over time as arrears, a sort of a fraction kappa of the debt accumulates and becomes future debt obligations. In this type of models, as is sort of a standard, we're going to have that there's going to be more incentives to default on the debt when output is low, when the economy has a lot of debt to begin with, and also when interest rates are high. So when these bond prices are low, and that is going to occur when there's sort of low future repayment prospects. So we're going to consider the sort of an integrated government problem where basically the government is deciding on borrowing, default on lockdowns, taking as given the evolution of the population groups of susceptible and affected disease, and also taking into account sort of the state variable of debt. But subject to, of course, the epidemic dynamics and subject to the resource constraint that I showed you. What I want to emphasize here is that this bond price, as I said before, is going to encode for future default risk. And that future default risk is going to depend both on the level of debt, that the level of borrowing that the government has, the level of debt that the government has moving forward, and also how these population dynamics and how the evolution of the epidemic goes through. And sort of just to say here, so in this type of model, we're going to just give you here like 1 second about how this is going to work. So, when the epidemic hits and there's a sort of incentive to lock down because there's value from life, and by having lockdowns, we can improve on the epidemic side. That is going to reduce output, and that is going to sort of these temporary shocks that we've been hearing about in the previous papers, and that is going to increase the incentives to default on the debt. Because this is going to be going to perhaps last a year, then that is going to put pressures into future defaults, which in turn makes the bond price depressed, sort of spreads high, and that is another reason why the government wants to default. At the same time, sort of the fact that these the low repayment prospects enable the prevent the government from really supporting consumption is going to make lockdowns more costly. So the government is going to think twice whether to lock down or not, because it sort of generates this spiral of a potential debt crisis moving forward. And that in turn is going to make the government sort of less likely to lock down. Okay, so that's the model. Let me move on to some quantitative plots and pictures and results. So as I said, we're going to parameterize the model to Latin America with using data on fatalities and using data on mobility from this Google Mobility database. I'm going to show you some paths of the variables of interest. After that, I'm going to show you the role of financial conditions by comparing our model with two reference models. One is going to be a model with perfect financial markets, and another one that is going to be financial autarky. And then I'll move on to the third point of the debt relief programs, both for voluntary restructurings and also from loans. So, there's going to be a set of parameters that we're going to take from other studies. There's going to be, many that are going to come from the epidemiological studies that we've seen. And also an important parameter is going to be this value of life, which we're going to just lift it from estimates for emerging markets. We're going to have another set of parameters that are coming from the sort of the default literature. By the way, we're going to have longer maturity debt. We're going to have this recovery so that the default episodes resemble actual default episodes. 2 points I want to, maybe we can discuss later if you guys are interested, but it's going to turn out that we're going to need, and this is not us, we've seen this in other papers, that this reproduction number, actually the underlying reproduction number, is time varying in order to match some of the paths that we observe in Latin America. So we're going to start with a reproduction number that is sort of from the Diamond Princess estimates, 2.6, and we're going to allow the reproduction number to fall. And we're going to calibrate actually some of those dynamics of the underlying reproduction number. The second thing is we're going to sort of cap them all in 2 years, so that in 2 years there's going to be a universal vaccine. Okay, so what is our calibration? So we're going to use data for 11 Latin American countries, and we're going to choose 4 parameters. So sort of the path of this reproduction number, the congestion effects for fatalities. So there's going to be a part of the fatalities that depends on sort of the health system, and it sort of represents this contagion effect. That is going to be a calibrated parameter. And also a sort of part of the cost of default, sort of the fixed cost of default. And we're going to fit the model to match 5 moments. Okay, one is going to be the data on deaths. So we're going to think about the peak of the daily deaths that we've seen and sort of average among Latin America, across Latin American countries, which is about 0.05 per 10,000 population, and also the peak of those timings. So this is a challenge of writing a paper that is sort of current, that the data keeps changing. So this is actually data up to October of 2020. And the second thing we want to do is we want to think about the lockdown intensity. So this is the Google Mobility data for sort of how mobility has went down, went down sort of about 48%, and that was actually in April. So we're going to have these 2 sort of targets, and then an initial debt to output ratio of 60%, which is sort of an average debt to output, public debt to output in Latin America. And so we're going to calibrate these numbers, and we do a good job. We're still working a little bit on it, but is a good job at matching these moments. We have additional out of sample moments. So one, for example, is average daily deaths. So we have a sort of a slightly higher than in the data, but sort of close. The average lockdown intensity, again, we have a little bit higher than but it's still in the ballpark. We also have observations on spreads. So, so one observation is the peak of spreads, and spreads here are coming from the MBs of the set of countries that we have data for. And so the peak in April was in the data about 5.5, and in our model that is going to be about 5.9. But so we're going to sort of have basically a pretty good fit on the peak, but in our model, the spreads are going to remain elevated more than what we observe in the data. This is average up to October. Okay, so let me now show you some of the same moments in plots. So we have here, so this is the paths. So the epidemic starts, I think, at the end of March. This is a weekly model. And we have here sort of the epidemic, the paths for fatalities. And you see that sort of the paths match fairly well. This is a fairly large health crisis. So if you think about sort of what the numbers mean, maybe, you know, for people that are following, you know, more close to the United States, about, you know, 5 per 10,000 is about 1,500 deaths per day in the US. This is a fairly severe health crisis. And then lockdowns are going to last about a year, okay? And, you know, for about 6 months of fairly high intensity. In terms of consumption and output, you see that sort of output is very depressed, a sharp contraction on impact, and then sort of slowly went back up, but fairly large drop in output during the first year, about 15%. Consumption is also depressed, but sort of less than output. You see here that maybe I should have had it one against the other, but there is sort of, when lockdowns finished, output and consumption remain about 6% depressed. And this is going to be because of the paths for debt. So debt is going to increase, starts from 61%, increases to about a little bit more than 70%, and then it slowly goes down. And this sort of slow mean reversion of debt, it's what's generating these persistent effects from this pandemic. We discussed the spread data, so the impact effect is sort of right, but our model overestimates so makes the you know, more persistent the elevated spreads. This is basically a summary of the previous graphs. Let me just say here to focus on this last number. So the welfare losses. So the country has this is very costly. This is about 28% in present discounted value of output is the cost of the epidemic. That's the 0.6% in slow consumption, and it's also fairly big for lenders as well. So lenders, because of the unexpected shock, are going to be losing about 7% of output from this epidemic. So one thing is, let me move on to my two counterfactuals. So we're going to do perfect financial markets, which is just the bond economy, and autarky. The first thing I'm going to use this table to highlight the deaths. Okay, so with perfect financial markets, we generate sort of the total deaths from this epidemic are about a third. Okay, so financial markets are going to interact with social distance measures to sort of have an effect on what the health crisis is going to be. And maybe it's best to show you this in a picture. So these are the daily deaths. So the blue is the baseline. You already saw that earlier. But you can see that with perfect financial markets, sort of the deaths are going to be much smaller. And the reason is because with perfect financial markets, the economy can afford having stricter lockdowns because it can use the international financial markets to support consumption. In my last few minutes, let me talk a little bit about debt relief programs. Okay, so so we're going back to the baseline. Okay, the baseline model with default risk. What I have here is in this plot is sort of different initial levels of debt. Okay, for an economy that has that starts this epidemic. So, for example, in our baseline economy, we had our economy that had 60% of debt. So it's this graph, this point over here. On the y-axis, I have the market value of debt, meaning sort of how much does it really, what's the value of that level of debt given future default risks. Okay, so the value is going to be less than the level and the book value, if you will, because of default risk. And what I want to show, what I want to highlight here is that, generally the market value of the debt increases with the level of debt. The more debt the country has, the more the market value it is for lenders. But when the debt crosses a threshold, like happened to be in this economy, there is sort of a situation where that reducing the debt from, for example, 60% to 52%, okay, or even 53% is going to increase the value of the debt. Okay, once you have that situation here, then this model gives room for voluntary restructurings. Okay, so the government, we can lower, actually private lenders and the government can get together and lower the debt from 61% actually to 52%, and that is of course going to make the country better off. But actually the sort of the surprising feature here is that the lenders will accept. Okay. So that's the first point here, and sort of this voluntary restructuring program, okay, can have big benefits to the country. So the reducing the debt from 61 to 52% is going to not cost the lenders anything. I mean, I showed you that's exactly how we designed the program, but it's going to increase the welfare of the country by about 10%. Okay. Another program we consider is this loan program. So, the type of programs we've seen the IDB and the World Bank and IMF extend to emerging countries. And what we simulate here is a program where this financial assistance entity gives the country a loan of 10% of their output. Okay. And they're going to repay it. Okay. It's a long-term loan. They're going to repay it. So the financial assistance entity does not lose any money, but it's default free. Okay, so it sort of has this extra commitment for this loan. And what you see here is that type of loan is also very good. So it increases the welfare of the country by about 7.5%, and also is going to help the lenders as well, because by giving them this extra cash, the value of the outstanding of the legacy debt increases, and that is going to increase the value of the lenders. Why are these values increasing with this sort of reduction in net debt? Well, or this extra support, because it's going to reduce the extent of the debt crisis. So the debt crisis is going to be reduced from 4 years to 2 years, for example, in the case of the loan program. And it's also going to allow the government or the whole economy to manage better the epidemic and prevent more deaths. Okay, so I think I'm running out of time, but sort of these two type of debt relief programs are very, very good in the context of this model, where sort of the epidemic is integrated and it feeds back into the debt crisis. So just to conclude, so sort of this pandemic creates challenges for emerging markets, and default risk actually exacerbates these challenges. And we've shown you that although the epidemic is very costly for all countries, it is especially costly for countries that have these fiscal limits. And in this context, debt relief programs have large social values, both in the context of restructurings and in the context of fresh new loans.
Thank you very much, Cristina, for the presentation and for doing that in exactly 30 minutes. Now we have 10 minutes for questions from the audience. For those that are panelists, if you want to ask any question, just go direct.
Yeah.
Okay, go.
Can I start? Very interesting paper on in some ways, but by reading the paper and looking at the presentation, I wonder, what countries you have in mind when you're thinking about this model. I mean, when I look at especially Latin American situation, I see that the country, Peru, the country that has had the worst outcomes, both on the health terms and economic terms, has had the most access to international financial markets. In fact, in November, Peru floated a bond that matures in 100 years with no problem, even in a situation in which the country was going through 3 presidents, right? And that's an extreme example, but when you think about other countries like Mexico and Brazil, I wonder if the prescription of your paper, which is, well, ask, say, international institutions to give them more cash, like more access to international financial assistance, would do any good. In fact, I think, for example, of the case of Brazil, then my impression is that would do exactly the opposite. And Brazil has been like running huge deficits with no problem also trying to find international financing for those deficits. So I wonder, to which countries your model might be applicable to.
Yeah, that's a very good question, and we have tried to sort of bring the model closer to the data, make it really more quantitative. The way that I sort of see this is we're thinking about, and we calibrate these to sort of the Latin American countries as a group, and sort of we haven't. So there, of course, there's differences between different Latin American countries, and we have not gone that route in this paper. But if you think about Latin American countries as a class in comparison with, for example, Canada or New Zealand, these would be sort of the first pass comparison that we are trying to capture here. And despite the fact that sort of, thankfully, countries like Peru have had access, especially more recently in the later part of the year, to financial markets. First of all, you don't know what the counterfactual would have been if they did not have access to that. Second of all, it's still sort of, debatably whether the type of access to financial markets that those countries have, including Peru, is similar to, for example, New Zealand. So I think that we're being frank, and I'm being here very upfront about the fact that in our model, we do sort of overstate the sort of the persistence of the debt crisis. Of course, we didn't. Maybe we should look at. So this is in the baseline without any financial assistance. We could think about, what would the financial assistance or the type of programs or the type of restructurings that have occurred. Actually, what would that do in the context of this model? But in terms of the impact of the spreads, for example, in early April and May, those jumps are very comparable to what our model predicts. So I guess that's my response is we're thinking about this as a sort of a emerging market as a class, but I think thinking about the details and the differences between the Latin American countries is sort of interesting, and we haven't done that. I have to say that and this is I referenced to in my presentation that it's sort of we realized that one issue with the type of SIR models or sort of that we work with, just plain vanilla with default, like our initial versions, is that the timing was not right in terms of the timing of the intensity of the lockdowns were early April, and the deaths are actually in the data we had July. Okay, so the timing is off. So that basically called for these sort of basically public health policies, which in our model we don't really have that, but we have sort of this reproduction number changing over time. That is actually important in getting at these timing rights. So, different health policies across the different countries, of course, are going to matter. This is not a comparative advantage, but just to flesh out what in the model could be driving some of the differences. It definitely part of it is these public health policies.
So, Cristina, can I ask a quick follow-up?
Yeah.
It's great presentation, very nice paper. So I was curious about the model over predicts the path for spread. I was curious about, do you have any higher frequency data on the evolution of output? So the model predicts a very, very large and persistent recession to some extent. I don't know whether that's part of it is that too large of an output drop for too long, or?
Yeah, so we had it, and we could. So in terms of the industrial production, I think that the decline is the impact decline is not so large relative to the ones observed. We do have in the first year that sort of to 2020, the drop is about 15%, and I think some of the estimates are maybe close to 10%. So maybe it's a little bit bigger, or maybe a lot bigger, depending. But I don't really know. I mean, it's not like off the charts, in terms of the decline. But we can definitely look into more now that,
It would be less, if the recovery were very quicker through to 2021, would that imply we have a large impact on the spread?
Yeah, so I mean, the two things. So the spread increases because output is depressed here, because debt is large. So sort of the debt of those countries went from, it remains elevated. It's coming down, but it's persistently. So the sort of persistence.
Do we have data for the debt dynamics?
Well, so we do have actually, Roberto had his presentation in a different, had shown me some data actually that seemed consistent in terms of the increase in public debt. So the increase in public debt of order of magnitude of 10% is not large. How soon this is going to fall is, of course, we don't know. Maybe it's not going to fall, but sort of the increases in public debt is basically, we have the right magnitude relative to what we've observed for these countries. But both things, you're exactly right. So the fact that the debt is higher, and the fact that the output continues to be depressed about 6%, 5% for several years is part of the reason why the spreads here are elevated.
Thank you.
Thank you, Cristina, and the other people that are making questions. We still have 4 minutes, so if somebody else have any question, you have time to ask.
Alberto, there are a couple of questions on the chat. So
I don't see that.
Oh, sorry. I will unmute Andrew Powell now.
Okay.
Oh,
yes.
Hi. Hello?
Yeah, hi, Andy.
Can you hear me?
Yes.
Oh, it still says mute. Okay. I enjoyed it, and I've heard the paper before, so it's really nice you now have the loan programs and the voluntary restructurings in the paper. That's great. I missed it. Maybe how do you calibrate the loan programs? And I was just wondering if it's optimal, if the loan programs are optimal in any sense. That was one question. And then the second one on the restructurings, I mean, I guess there's kind of, you have the voluntary, so the lenders don't take any hit, but then I guess you could sort of think of an excusable default, let's say, and then a non-excusable default. And one would imagine that the costs of an excusable default are lower, and your calibration is probably some average of past experiences, right? Or something like that. So perhaps the cost of an excusable default and restructuring where the lenders do take a hit would be lower than your calibration. So those are my two questions. Thanks.
Yeah. So on your first point, so we this is not an optimal loan program. This is we didn't actually calibrate this program. We're just thinking about some properties of the programs that we've read from the IDB and the World Bank. We actually have a little bigger because some of the biggest ones are like 5% of output. That would be very big. Our program is sort of higher than that. It's 10% of output. And but it's just a long-term loan, actually a perpetuity loan that is default free. And we could think about other, and we actually in the paper we do have, and we're working on just like a menu of programs that you can maybe choose from. But the properties that are the attractive properties, good properties, are long-term is key. Okay, so short-term is going to be too costly. The economy is in this sort of a hole for 1 year, 2 years, 3 years. Okay, and then it is sort of better to sort of delay the repayment to after that. So that's going to be one part that is key. And the second one is, big. The bigger, the better, in a sense. I'm not sure if it's like always monotonic, but we've done like 5 and 10 and 15%, and always, bigger programs are going to be better. In terms of so we did not really think about excusable default here, but we do have that upon the epidemic, the lenders are losing money because they didn't expect these epidemic to happen, and so sort of, for example, the loan program here, or even the voluntary restructuring, sort of the lenders are not losing any money relative to the loss that they had in the epidemic. So they're losing 7% because of the epidemic, but they're not losing even more because of the restructuring. But we can think about, those could be parameters that one can evaluate multiple possibilities. We haven't done that, but that's something interesting we could do.